some numbers in regards to the national expenditure on matters health. Now, the national government total expenditure on health services rose by 33.1% from 88.2 billion shillings in the financial year 2021-2022 to 117.4 billion shillings in the year 2022-2023. And when you see a sector attracting this kind of jump, look at this particular financial year. It is just after we had the COVID situation and everyone was very, health aware. Then the government decided to increase the allocation to the health sector to 117.4 billion shillings. It shows that not only investment is growing the health sector, but at the same time, it is indicative of how vibrant the sector is. Now, let's talk about counties because we have devolution in the country. Counties spent 108.3 billion shillings in the health sector. And question is, what was this utilized for? And does any of that go towards matters to do with or going electronic? Good discussion right there. Let's move to the next slide because we want to take a look at the status of health in the country in regards to diseases. This will show either we are getting healthy or not. Remember when the Cabinet Secretary for National Treasury was reading the budget, one of the elements that was being taxed was sugar. And he noted that we have many cases of diabetes in this particular country. So we are taxing sugar to make Kenyans healthier. But that notwithstanding, all these statistics did come from the Economic Survey 2023, courtesy of Kenya National Bureau of Statistics. Now, in terms of diseases are reported, and this is not the number of diseases but the number of cases of diseases reported. It decreased by 6.9% in the year 2022 to 87.8 million, and the majority of these cases surrounded respiratory system at 19.5% and malaria at 11.7%. Now, this is actually in the year 2022, according to KNBS. Moving on swiftly now, let's take a look at facilities because health does not exist in the air. Now, we have facilities in the country, and looking at the year 2022, facilities actually went up 2.2%. Now, this is a very marginal increase, but 16,517 were the number of facilities, and this was because of the number of level 3 facilities that were rolled out in the year 2022. Hospital beds also went up 5% and hospital cots 4.7%. Now, closing up this particular discussion, investment into the health sector, looking at the current financial year. If you're listening to Professor Ndingo, he noted that we are allocating 141.2 billion shillings towards the health sector. But let's go into specific programs because it's critical to understand where this money is going. Now, health budget. Amongst the 140 plus billion allocated to the health sector for this financial year, universal health coverage taking 18.4 billion shillings. Remember, this was one of the big 4 agenda under the former government, Jubilee government, and when the Kenya Kwanza came in with the better bottom-up economic transformation agenda, they are continuing with that investment in universal healthcare. We also have Kenya COVID-19 Emergency Response Project getting 3.7 billion shillings, and this shows the issue of COVID. We are not yet out of the woods, not only economically but health-wise. Free maternity healthcare received 4.1 billion shillings, and management equipment services 5.9 billion shillings. We still have some more allocations in regards to the specific sectors. For example, we are looking at allocations towards medical cover for the elderly, which comes in very, very critical when we age. And we've seen that expose. I understand you've seen that expose by BBC, what is happening in one of the elderly care homes in this country. So this just shows how critical this cover is. And It's been allocated 1.7 billion shillings on matters to do to reduce HIV, malaria and tuberculosis. 24.8 billion shillings was allocated, and enhancing vaccines and immunizations program 4.6 billion shillings. That is the status of financial allocation towards health sector in regards to the current budget. Now, with that said and done, question is, even as we transition into the digital space that we are in, it becomes very imperative that we have a conversation in regards to the status of e-health in Kenya and Africa at large. Now, according to the Journal of Global Health, a total of 738 digital health interventions in Africa, actually specifically sub-Saharan Africa, were included in this particular analysis, and we want to break down some of the numbers. Now, for countries, that is 8.5% of the countries that were sampled, Kenya, Ethiopia, Uganda and Malawi contributed 34%. So you find there are markets or rather countries within the sub-Saharan Africa that do have dominance when it comes to DHIs and the implementation of DHIs thereafter. And apart from that also, we see that these markets can be classified as established. Now, 2 of every 3 are only focused on solutions in one building block, limiting integration. Most 92% require health workers' engagement for them to work. Now, the largest proportion of these digital health interventions, close to 84%, are focused on mining data as opposed to improving provision of services. And this brings in the question in regards to the big players in